Hi, my name is Mara Becker. I'm a PA at Chief Andrew Isaac Clinic. I work in the Department of Employee Health. Today's Medical Minute is all about infections. What causes infections? When should you see a provider for an infection? How do you treat an infection? What are some of the side effects of the medication? How long should I take my medicine for? What if I feel better after a couple of days? Should I continue taking my medication? These questions will be answered in today's Medical Minute. Infections can be caused by bacteria, viruses, fungi, or parasites. These germs can enter the body through our nose, mouth, or a small cut in the skin. Our bodies are made to naturally fight off infections, but sometimes our bodies need help. If you have an infection that won't go away or that causes a fever, chills, pus, or red streaking from the wound, you should see a provider. Our providers are trained to spot signs and symptoms of bacterial, viral, fungal, or parasitic infections and will only prescribe antimicrobials when you have an infection that requires treatment. This is important because overusing or incorrectly using any of these medications can cause resistance. Resistance is when a germ learns how to avoid the effectiveness of a medicine. This can make it harder to treat the infection and might require you to take stronger antimicrobials than necessary, which tend to have more side effects. There are different medications for different infections, such as antibiotics like penicillin, antivirals like Tamiflu, and antifungals like Lotrimin. All medications can cause side effects, adverse effects, or allergic reactions. Some common side effects are diarrhea, nausea, dizziness, and sun sensitivity. Side effects are different than adverse effects. A rare but serious adverse effect is an infection in the stomach called Clostridioides difficile, or C. diff. C. diff is a bacteria that can overpower the gut's natural bacteria and cause severe diarrhea. C. diff is very hard to treat and can keep coming back even after the antibiotic is stopped. C. diff may present with numerous watery loose stools or diarrhea, stomach cramps, or blood in stool. And these symptoms can occur days and even months after stopping the antibiotic. Please call the clinic to make an appointment if you're experiencing any of these symptoms. One way to help reduce your risk is to ask questions. Ask your provider or pharmacist how long you should take your medication. Every infection is different and you may need a longer or shorter course of treatment. Ask your pharmacist what to do if you miss a dose or stop the medication early. And remember, don't ever share your medication with others. Another way to reduce your risk is to get vaccinated. There are vaccines that can help reduce the risk of infections, like the flu vaccine, COVID-19 vaccine, tetanus vaccine, and pneumococcal vaccine, to name a few. Vaccines aren't 100% effective, but they reduce your risk of serious illness when you come in contact with that bacteria or virus. Also, wash your hands and use hand sanitizer often, and stay home if you feel sick. If you are not fully vaccinated, please continue wearing a mask. This will help reduce the spread of COVID and other viruses. TCC is working hard to reduce you and your family's risk by forming a committee of providers, pharmacists, dentists, eye doctors, and numerous other staff that work hard to keep up to date on the current guidelines and recommendations for infections. This group is also working on a penicillin allergy testing clinic that will likely be starting this year. Penicillin or amoxicillin allergies are the most common allergies that patients list, and only a small percentage of people are actually allergic. When a patient has an allergy to penicillin or amoxicillin, they have to get stronger antibiotics, which tend to have a higher chance of side effects. This is a group effort, and you are part of that group. For more information, visit these websites. Thank you for watching today's Medical Minute, all about infections. Please contact Chief Andrew Isaac Clinic if you have any questions. Thank you for watching.